Sir, we are suspecting multi-system inflammatory syndrome in newborn in this baby. Sir, we want to see the coronaries in this child. So how to demonstrate the coronaries in the
Yeah, good. So whenever you suspect anemia, multi-inflammatory syndrome, so always better to work on this. It's not a must that to diagnose coronary arteries always should be related, but you have all the symptoms and signs which you are thinking towards MISM. So definitely one should demonstrate coronaries. So why do we demonstrate coronaries? Because in MISM, coronary artery dilatation will happen. So for that, what we should do is, and you take a probe which has got high frequency. Here we use in 4 and 12 frequency probe. It's also called as footprint probe. You take, make sure that it is sleeping, okay, and that will cooperate for your examination. And always use warm gel. And this is the area what you have to choose. Parasternal short axis view you have to take. For that, you keep your probe in the second or third intercostal space. Okay, you see how I keep with the marker facing the left shoulder joint. Are you okay with that? Yes. Now you can see here, you can see the image. The image shows a root of aorta. So you can demonstrate the image on echocardiogram. You can see this. So you have got in the center, this is a parasternal short axis view of the heart, where in the center you are seeing the root of aorta. Okay, this is what exactly you have to see to demonstrate. What view? It is a parasternal short axis view.
Sir, in this view, how to locate the coronary arteries?
That's a good question. So important is once you know that, you need to know cusps. There are 3 cusps in the aortic valve. One is called as in the root of aorta. One is called as right coronary cusp. Okay, and then you got left coronary cusp, and then you got non-coronary cusp. Means what? From the right coronary cusp arises what is called a right coronary artery. Can you see that?
Yes, sir.
Can you see that right coronary artery arising from that?
Yes, sir.
That is the right coronary artery. I'm just zooming and showing you. Okay, see beautifully. You can see that right coronary artery. This is the right coronary artery arising from the right coronary cusp. Okay, understood?
Yes.
The opening, it starts from opening in the right coronary sinus called ostium. From there it starts. Can you appreciate that?
Yes, sir.
And also you can see from the left coronary cusp, another going is called as left common. Can you see that left common? I'll show you, zoom it also again. Yeah, you can see that. There's a left common, left coronary artery is running. I'll show you that. Okay, and that will branch into left anterior. That is ascending. That is LAD. LAD is what?
Anterior descending.
Correct. So left anterior descending vessel, and also you can see circumflex vessel. Okay. So these 2 branches you can see, right coronary artery, left coronary artery. Okay. Yes. Any doubt?
No.
So you can see that. So what you should do is you have to freeze the button here. Freeze the button. Then this is the right coronary artery. Around 4 to 5 millimeter from the ostium, the internal diameter has to be measured. You take the caliper here. Okay, you take the caliper here and measure from here. This is so it is. So how much it is? So it is 1.75 millimeter. Okay, internal diameter of the right coronary artery. So are you okay? Now, the next important thing you should look at is, again, I'll demonstrate how to measure the demonstration of, For the demonstration of left coronary artery. Okay, now I'll freeze it. Then I'll take the diameter here. Yeah. Now you see, I'll measure from the diastema again, the internal diameter, and it is 2.34 millimeter. So that is the internal diameter of the left coronary artery. Okay. And also, you can also measure the left anterior descending artery also. It's about 1.49 millimeter. So now what we should do is, once we know the diameter of that, somebody should tell me what is the weight of the baby, length of the baby, and with that we find out body surface area. So what is that?
Weight is 3.14 kgs, length is 48 centimeters.
Yeah.
So body surface area according to that is coming 0.205.
Yeah. Yeah. So what is the score you got?
So for the left main coronary artery, Z score is 4.02.
Yeah, is it significant or not? So that means Z score here is 4.02 for right coronary artery,
Left main coronary.
left coronary artery, and which is significant. So that means left coronary artery is dilated here. Okay. And what happened to the right coronary artery?
2.72 is the Z score.
Yeah, is it significant or not? So that means both right coronary artery and left coronary arteries are dilated, but more on the left side. So that means it indicates that this coronary artery is dilated. And a bit of, you can see that they are dilated towards aneurysm also. Correct? So even in the context of high cardiac or high heart rate, that means the heart rate is 131, 132. The speed of heart rate usually will not be coronary artery becoming so prominent. And usually, in elder children and where what they do is they reduce the heart rate to get good calories. But here, despite good heart rate, that is heart rate on the higher side, calories are well appreciated. So definitely there is significant dilatation of calories. So what did we learn? How to position the probe, how to get the parasol short access to it, identifying the right coronary cusp, left coronary cusp, non-coronary cusp. And then right from the right coronary cusp arises RCA, that is right coronary artery. And from the left coronary cusp arises left coronary artery, branches into left anterior descending left circumference. So here both right coronary artery and left coronary artery. Anything you want to ask me? So we understood that right coronary artery dilated, left coronary artery. My friend asked what? So we are suspecting a case of MISL. So why did you suspect MISL? Because this baby had decreased fetal movement. Baby required ventilation at birth, then intubation. The echocardiogram when they did, the left heart dysfunction, the myocardial dysfunction was there. It was a global dysfunction. It was not contracting properly, and bit of pericardial effusion also was there. So, in that context, they thought of whether they are, but this baby also when baby was born, baby cried, Apgar was good. So, more than hypoxic ischemic encephalopathy, they thought of are we dealing with a case of MIs. Clear? This baby heart was not contracting well. So we had to give something to improve the cardiac output and contractility. So in the referring hospital, baby was given adrenaline infusion and also lobotommy. And at one point of time, this baby also they thought of having ECMO as an additional therapy. But when baby came to us, baby heart was functioning well, and we could reduce one of the inotropic supports also. And then slowly started weaning down the respiratory support in the form of oxygenation and ventilator parameters. And definitely it showed improvement. And in addition to that, as a MISN, it is our duty to look at any other organs also affected. While doing that, we could find that there is also a bright shadow around the frontal of the lateral ventricle, extending to the parietal and occipital area. So now we have got an organ more than, so this may be a respiratory failure, cardiac dysfunction, and also involvement of the brain. So definitely it's an inflammatory syndrome, and that's how the instrument here is definitely I know work. And with all these evidences, we also started the baby on intravenous immunoglobulin and meter. Now, as you see, baby was on ventilator, high parameters, now requiring CPAP, currently breathing well, good heart rate, good saturation, with a requirement of around 21 to 23% of oxygen. And it is doing well.
You mentioned in the multi-system involvement, there is some brain pathology. So, can we see that, sir?
Yeah. So, there's always the beauty of bedside ultrasound. Whenever you have pathology in one organ, always better to look at multiple organs. One such organ where baby's heart has got very much love is with the brain. So always look at the brain when you are dealing with the heart. Of course, other organs also you need. So for that, in this baby, I said there is a pathology. So I demonstrate you what is the pathology. Now, this baby, if you look at this image, I'm just going the brain scan. This is the ultrasound brain coronal section. And then what I do is I'll just do an anterior to posterior sweep. You see what you see here, ventricles you can see. Then on the left side, see you can see that hyperechogenic area around the frontal horn. It looks like, a fan shaped. It is a hyperechogenic shadow. So, you can see beautifully, and somebody can point that with a pencil or something. Yeah, that one. That is a hyperechogenic shadow, and possibly it is a hemorrhage or infarct. Okay, now you see.
Yes.
This is the pathology. So any bleed in the parenchyma, okay, we call it as grade 4 intraventricular hemorrhage. So in this baby, you see the pathology. History showed decreased fetal movement, then required intubation, cardiac dysfunction, and then coronary artery dilatation. And you can see this pathology here, the hyperechogenic shadow. And so this is the hyperechogenic shadow. So what exactly you think? It is definitely it is a multi-inflammatory syndrome. And then fits into what is called as MISL.